Hello, my name's Ethan, and welcome to My Matters. Today we have a very special guest. Jessica, do you want to go ahead and introduce yourself?
Sure. So I am Jessica Myszak. I am a psychologist in Glenview. I have a private practice called the Help and Healing Center. And my goal is to provide neurodiversity affirming psychological evaluations for children and adults. And, I also try to give other helpful information to autistic individuals. So I do a lot of atypical presentations for autism. So, high masking autism, PDA, and, late diagnosed people that, oftentimes weren't very clearly diagnosed when they were younger. Um, and, in addition to seeing clients, I do a lot of social media stuff too. So share information on TikTok and share some information on Facebook and Instagram. And I'm always kind of looking for ways to continue to support the autism community.
So,
When you
yeah,
so
Ben.
go ahead, Ethan.
So, does your practice mainly focus on ADHD, autism, or do you guys also specialize in general stuff too?
Yeah, so we do a lot of different types of evaluations, but I would say that yes, we do specialize in autism and ADHD. And for the most part, people who are seeking us out are usually seeking us out for that specific reason. So usually they, recognize that it might be a little bit more complicated. Maybe they're, an adult and it felt like, well, nobody ever really thought there was anything there, but I keep noticing this thing. But yeah, I mean, we also sometimes do, pre-adoption evaluations and evaluations for veterans or people who are wondering about learning disabilities and other types of things too.
So do you focus more on like testing and you said affirmative care for autism and ADHD. So does that mean like testing and diagnosing people and then they can go get treatment elsewhere? Or do you diagnose and then do treatment as well?
Yeah, so for the most part, I do the diagnosis.
Got
So yeah, and the process looks totally different depending on if it's a younger kid or a teenager or an adult. But yeah, I mean, a lot of times for kids or teenagers, parents are requesting the evaluation because, either something is, really, really challenging at home, or, the kid might be really having trouble in school. So they're trying to figure out, are there things that we need to do differently? Are there certain supports that would be important? Um, as adults, it's kind of different and it's interesting. I mean, some people also need accommodations. Some people, who are in college or maybe they're realizing in work they need certain types of accommodations. So they're, it might be important to have a diagnosis. But a lot of adults, don't really need any official diagnosis. Really, they're trying to solve, what's going on with me? Why do things seem to be different? Are there reasons why, these kind of things seem to be really hard and they seem easy for other people? And so with that, it's a lot of validation and it's sometimes kind of problem solving. And some of these people have gotten diagnoses over the years that they're like, it just doesn't fit. Like it just isn't the right thing. And so, yeah, if I can give them helpful information, even for them just to do things differently in their life, I think that can be really life changing sometimes.
it. So
Mm.
what did you mean by like it when people realize over the years that it doesn't fit? Can you expand on that?
Yeah. So one example, so we're talking about both autism and ADHD.
Right.
And I would
Yep.
say, sometimes those things can often occur together. And sometimes somebody who is both autistic and has ADHD has both of those diagnosed at the same time. But often that is not the case. So lots of times somebody might, be noticing that they have trouble at home. And so they, maybe get diagnosed with ADHD, but then as they might start therapy for ADHD, they might start taking medication that helps. And along the way, they're noticing some other quirks that they have. They're noticing some other things that like isn't really related to that ADHD. So that initial thing, like, it doesn't quite fit. Um, there are also some personality disorders or some other types of conditions that I sometimes see as misdiagnosed autism. So bipolar disorder is one of those examples, where somebody who is really struggling and having a hard time, with emotional regulation. Maybe they get really easily frustrated, or they have a really big temper, that doesn't seem to fit with what other people are experiencing. well, maybe they're getting diagnosed with bipolar disorder, but you know, it doesn't quite fit, like it's not necessarily that they're just having these ups and downs. There might be a reason for it. And if it's autism or ADHD, maybe there's some sensory sensitivity, maybe they're getting overstimulated. Where, yeah, I mean, rather than taking a pill every day, maybe changing the lights in your house, or maybe paying attention to like the scents that you use around your office or your house can really make a huge difference. And so sometimes, like, you got to really change the way that everything typically goes, and suddenly everything is fixed.
Yeah, that's really. I'm sorry for taking up talking so many times in a row. Ethan can be, you can go next, but I think that's you know really interesting that you view like diagnosis as something that can fit and something that cannot fit. Because I think a lot of times people, when they're talking about finding things that fit in the mental health space, they're talking about medicines or they're talking about treatment, and there's obviously a lot of turnover in those spaces and rollover. But a lot of times people don't think about the diagnosis as something that can fit and something that can change based on new understanding. And I think that once I think, I mean, not to, speak to other people's experiences because I never, not necessarily have had them, but I think sometimes when people have that label of somebody who has like autism and people know them as somebody like that, not necessarily in a bad way, just the fact that they have it, it's kind of hard to shake that label down the road. So I think that's really interesting. I've never thought about it that way. So thank you for telling me about that.
Yeah, no, and that is, I think you're exactly spot on with that. And I see that with some of the clients that I see sometimes where, yeah, they have one thing diagnosed and then anything else gets attributed to that diagnosis. And unfortunately, there's some diagnoses out there that have more of a negative connotation with them. And so sometimes people will get really frustrated. I think bipolar is one of those. Another one is borderline personality disorder. And unfortunately, once you have one of those diagnoses, it can be really hard to find a mental health professional who is going to consider anything else, because they're tough.
Mhm.
So you
And
mentioned, oh, sorry.
no,
Uh,
you're good.
you mentioned that some of these other issues like bipolar have a negative connotation, right? So I was just wondering, like you also mentioned at the beginning that your diagnoses are neurodiversity affirming. What does that look like, especially when people are concerned about these negative connotations? Like how do you help them recognize that and also affirm their neurodiversity? Kind of along the lines of what Ben was saying as well, with the labeling of being an autistic or having ADHD.
Yeah, no, and that's a great question. So again, I think it varies depending on the age, but essentially, I am trying to meet people where they are. So one of the things about my practice that's a little different that makes it more affirming for people is you can schedule the appointment and kind of have everything ready to go for the appointment without making a phone call. We do a lot over online, texting and emails, because for a lot of people, like making a phone call can be really scary. And so we try to be very, very transparent and really making the process very open, lots of check-ins with people. But when it comes to diagnosis, we, and I personally don't see, ADHD or autism or any kind of other mental health condition as a negative thing. And I think that this is a shift, that we have, as a field, we use the DSM-5, and this is how we diagnose. And essentially it's a list of problems. It's a list of deficits. And so even, when I am making a diagnosis, when I am sharing information with either parents of a child or with, a teenager themselves or with an adult, I'm sharing, we're looking at this information in comparison to a neurotypical population. And so, I get these things feel kind of bad and it's kind of, laid out in a negative way. But, these don't have to be negatives. And, there's also a lot of strengths that are associated. I think a lot of the people that I evaluate and diagnose with autism as adults, I mean, are leaders in their industry. They are entrepreneurs. They sometimes see things in a different way, or can see things in a really detail-oriented way that is a significant asset for what they like to do. And really, I think, that if people can find a job that, aligns with their interests and aligns with their strengths, that can be a really, really good situation for people. And so that's kind of my approach to make it more neurodiversity affirming, is really to, and again, and telling people that, I'm going to share information with you, but you get to decide what to do with this. You get to decide, that, yeah, if you're, I think one additional challenge, and I know I'm kind of all over the place here now, is, for a long time, we have assumed that, the doctors should tell the autistic people what to do. And what's really, really cool about right now is there are a lot more autistic adults who are sharing their own experiences. And, these are, some of these are professors and researchers themselves. And so it's a really great opportunity, rather than like telling somebody who, you don't completely understand their perspective, to somebody saying, hey, this is how it is. I can share what this is like. And so again, like not putting your own values onto somebody else. It's not my job to tell somebody, well, you should have 10 friends, or you should be able to, do this, and this is the kind of job that you should be able to have. It's really to affirm, okay, what are the things that you want, and is your lifestyle supporting that?
Yeah, I love how you mentioned that the contrast between, you use the DSM-5 to diagnose, right? But I think that the stories that people share kind of move the perception of them off of just a book and a definition. And I think that's really important, so people can understand, for number one, for breaking the stigma, but number two, understanding how they're actually experiencing things, because it's different for everybody. Obviously, there can't be a definition for everybody, and I think obviously there are different variations and different like intensities that people have autism with. So I think yeah, sharing stories, and you said you would do work on social media, and obviously that's helping achieve those goals.
And I really liked the idea of seeing, different neurodiverse traits as assets in particular industries. You mentioned that some of the people have become leaders in their industry, and I think that's a really powerful thing, especially culturally. Some of these things have negative connotations, and just seeing it in that more positive light is definitely an important message, especially when it's so true. And many leaders can succeed especially well when they have symptoms of autism or ADHD. It's powerful.
Yeah. And what's interesting, and it makes sense, but I didn't think about it as I was setting it up. But, by having a neurodiversity affirming practice, I actually see a lot of children who have autistic parents. And so, even if I haven't diagnosed the parents, and sometimes they've been diagnosed, sometimes they're self-diagnosed and they say, yeah, I know I'm autistic. I don't need an evaluation. But it's really interesting, even to have these conversations and have some of these interviews and have them fill out rating scales and things, because, many of these parents are like, well, my child is just like me. This, in our household, this particular thing isn't a problem. We accommodate it. We figure out how to make it work. So it might not show up as a problem on this measure, but it's still something that's there. And so it kind of presents some interesting issues, because again, a lot of these measures were designed for, neurotypical parents to fill out for young children. And as we're moving into assessing, different types of people, different ethnicities, different genders, older people, some of the main things that have a ton of research don't really work as well.
And something I feel like the word ADHD has been thrown around a lot. I feel like it used to have a really negative connotation, but for me, as a high school kid, when I'm like at the library or doing work, I see a lot of times kids who can't really focus or do the work. They're like, yeah, I have ADHD, and they kind of self-diagnose that. And that's like the reason why they can't focus, or they struggle, doing their work. I kind of just want to ask you, like, how much of a problem is that self-diagnosing ADHD when it comes to like focus? And is it usually ADHD that hasn't been diagnosed, or is it usually something else that they can work on?
Yeah. So, I wouldn't say that there's one clear pattern. So I think, when somebody is coming into my office for an evaluation, there's a reason. Like people who, everything is going great and things are perfect, like don't usually get a psychological evaluation. So, it does happen sometimes that, okay, yeah, there's nothing really clear to put our finger on, but a lot of time there's some explanation for what's going on. And so, yeah, I agree. I think there's a ton of information out there about ADHD. People talk more openly. I think it's become much more socially acceptable to talk about it, which is great. I think as a mental health clinician, like that's nice. I think the more that people accept, any part of mental health, the more they're going to be open to other things that might have some more stigma behind them. So, I think that, and even with ADHD, there are different types of things that people will do to help. So medication is one of those things. So yeah, I mean, we certainly don't want people abusing medication that they don't need. But there's a lot of other things that can help people with ADHD, things like setting alarms on your phone, having a checklist, kind of structuring your time. It's sort of like external supports, the Pomodoro method, if you're familiar with that. And so, yeah, I mean, if you notice you have trouble focusing and those are things that help, I think there is no harm in using those types of strategies. I think where that can get a little tricky is if somebody assumes it's ADHD and maybe it's something else. And, whether it's more anxiety or OCD or, depression or something else that, there might be a more effective treatment. There might be something else that could improve things more for that person. I think that's where an evaluation can be helpful because it can really either say, yep, you're on the right track, keep doing this stuff, or hey, this stuff is helping, keep doing it. But also there are these other things that might be really important for you to be aware of.
So
Yeah.
I know you briefly talked about transitioning towards diagnosing other cultural backgrounds, and I was just wondering, like, given the impact that having these diagnoses can have on a person, like as far as affirming their neurodiversity and giving them a better understanding of their behavior, how have you kind of adapted, or how does diagnosis look different depending on like cultural backgrounds, just in general? Like, what are some of the different things you have to take into consideration when treating someone or diagnosing someone of a different background or ethnicity?
Yeah. So, even in my time as a psychologist, I think that it has changed. I think that when I first started working with, primarily children, the common thing that would happen is we would share a diagnosis and the family would cry, that they would think, oh my gosh, this is horrible. And we don't know what to do. And we were often recommending ABA therapy, which is a behavioral therapy, working on specific skills. And as there's been more knowledge, as myself and many other professionals have learned more about how to better work with autism, how to better approach this in a neurodiversity affirming way, it is more often good news because families, I think that there's more education out there, there's more information. Families are coming in having a pretty good idea of like, I think this might be what's going on. I think this might be, this particular thing. And so lots of times they have their own ideas, and they've already started accommodating. They've already started figuring out how what's working either at home or in the classroom. And so when you're sharing information, they, are excited. Yes, we were on the right track. All right, these things we thought were helping really are helping. And so I think that that's great. Again, these are the people that I'm seeing and the people that are coming in to see me. So from that cultural piece, I think sometimes extended family can be tricky. So, absolutely, I have some clients who are much more nervous about me speaking with their parents, or they know that their grandparents or their siblings, are just not going to understand. And so I do spend a lot of time talking with clients about, how can you share this information in a helpful way? Or how can you make sure that your needs are being met, while also not feeling like you're, changing everything about your home dynamic if that's not something you want to do.
I just wanted to go back to something you were kind of touching on a little bit before with medicine. You were talking about we don't want people abusing medicine, but I kind of wanted to bring up another issue. And just to tell our viewers and I have been diagnosed with ADHD. I think I don't remember the exact age, but it was around 9 years old, probably, I would say. And I started on medicine, right, for ADHD. But in almost a weird way, like it helped, but I didn't like it because I got so used to how I lived with ADHD and how I thought, and it just felt like, and it was, and obviously there are side effects. I think some of the medicines like make you take away your like appetite during the day, and I hated that. And so I actually like stopped for a while, and then I went back on it, and it was kind of a weird experience because it was like, yeah, I wanted to solve these symptoms that I was having, but I also, throughout my time, I've kind of figured out how to embrace how I think differently with ADHD and focus, and I like that about myself. So I, it was weird. It was a weird experience. So I, you mentioned people like abusing medicines, but do you see that also more commonly, like people being hesitant to take medicine because like they're like, yeah, okay, I'm maybe even an adult. I'm like 30 years old and I got diagnosed with like ADHD or some like other mental health issue that I could take a medicine for, but this is who I am. Like this diagnosis just better helps me understand who I am and maybe change some aspects, but I don't need to take like medicine. Do you see any of that?
Oh yeah, I would say a lot of families I work with are, certainly don't want to try medicine as a first
Yeah.
resort. So many of them are open to it if it gets to that point. And yeah, I mean that's not my first recommendation usually is, all right, what are these other things we can try? How can we help? Um, and I think what's really tricky about mental health medicine is it's not as straightforward as a lot of other types of medications. So, ADHD medication in general, I mean, there's several different types of medication. And I don't know if you had to try different ones, but a lot of kids do. I mean, a lot of kids try
I think
something, negative side effects, try something else, doesn't really work, and so it can be really hard. And I know families especially worry about, they don't want their kid turning into a zombie. They don't want it to change, the whole personality of their child. So yeah, no, I think that's challenging. And then on the other hand, there's also people who are like, oh my gosh, this is life changing. How could I didn't realize this is how other people thought.
I think that the zombie thing is actually something in a way I'm not trying to, like take shots at myself here, but I think that that in a way happened to me, I guess, because also, I'm someone who has had always social anxiety throughout my entire life. But when I took the ADHD medicine, that makes me more focused. It made me like, I notice now I don't really like do like work throughout like lunch at school or anything. Like I just talk with friends who are there. Like when I'm on my ADHD medicine, like I need to be working. Like I cannot like, and I think that really had a social tax on me. So that kind of goes back to maybe diagnosing like multiple things at the same time and how they could affect each other. And it's kind of like almost a chess match, like not how we can fix everything, but how can we optimize all of these different things that somebody's struggling with to create, the best life possible, right? And for me, I think that I would rather trade having, lunch, being able to talk with friends than doing that. So, I mean, can you speak to that a little bit? Like when you would diagnose somebody, maybe they're having multiple issues. How do you weigh like treating different ones and trying to make them fit together?
Yeah. Well, and I think ADHD specifically can sometimes cover up a lot of other things. So, especially a child who is really hyperactive, that's usually going to be pretty obvious. So, I think lots of times, even teachers will be like, has this kid been tested before? Or like random people will say, oh man, that person has a lot of energy, like they're observable, noticeable traits that, sometimes can be very, very present and obvious. And so again, it's not uncommon at all for that to be the first diagnosis. And it's hard to see some of this underlying stuff until that's effectively treated, whether that's with medication or, just effectively accommodated. Um, so, my goal is always to try to get the best information I can. But yeah, I mean, especially with ADHD, sometimes you just have to start with that And then that's one of the reasons why we do recommend getting an evaluation every couple of years, once somebody does have a diagnosis, just to see, because strengths and weaknesses can change. There's new things that come up, and so priorities change, and I like to try to, I usually give a lot of recommendations in my report, but also try to stress, these are the most important things, because I think it's very easy for either clients or their families to get really overwhelmed. And, the goal is not to, feel like you have to take out a second mortgage and you have to, hire a nanny to be able to, fit in all these different things. No, like, kids still need downtime, you still need relaxation. And so, usually there's one or two things that make sense to start with. And then, once you feel like that's at a good place, well, maybe there's something next. But yeah, you can't do everything all at once.
And I feel like in regards to medication, something that I see a lot with ADHD and people who just self-diagnose themselves with ADHD is Adderall. And I feel like I've heard some stories of like college kids, they have like a big final they got to cram for, and they kind of find Adderall like, not prescribed. And I feel like that could be a big problem. Like, how much do you advise against that and warn people about?
Yeah. So yeah, I mean, I definitely don't think that's a good idea for people. And again, it's never a good idea to take medication that that isn't yours, because sometimes they have negative side effects. And I will say that, Adderall specifically, it's a stimulant medication. And so, sometimes I will see people who have anxiety who take it, and it makes the anxiety way worse. I mean, so it could have a really negative um, effect, which would be, terrible if you're trying to study for a test, or that you're taking a test. So again, it's something that, if your brain needs this, great. This is something that can help. But I would say if you don't need that, yeah, you're probably better off just, putting in a couple extra hours of study time.
So, a lot of this, the distinction between childhood and adult diagnosis got me thinking about like masking behaviors, like adults who were encouraged not to display traits of ADHD or autism in their childhood. And so maybe when they're getting a diagnosis, they're more reluctant to open up, or their behavior has just adapted over so many years to kind of be more neurotypical appearing. How do you deal with adults who kind of present this masking behavior, and you're in like a clinical context, like they've not really been open about their symptoms, and so how do you guide them to embrace their neurodiversity more?
Yeah, no, and that's a really, really good question. And you're right, masking is a big problem for people. And so part of the way that I manage that in my assessments is I've started using a different tool. So I used to use a tool called the ADOS-2, and this is like a structured observation. And so, even it works well with little kids, but we would still kind of have a version of it working with older kids and with adults. And essentially, you're doing these activities trying to elicit certain types of behaviors, trying to see, are they making eye contact? Are they, asking me? Are they, making appropriate comments? And so somebody who's really good at masking is able to fly through that. Like, that test is not going to identify some of these problems, because they, of course, they're not trying to show, these insecurities or these things that they might perceive as weaknesses or difficulties. So instead of that, I use it's a structured interview. It's called the MIGDIS-2. And essentially it's going through and, asking people about their experiences. So it's really, much more of a client empowered model rather than me making these judgments. It's us kind of having a conversation about, what is eye contact like? Like, is that something that, that you have to think about or that bothers you? How often do you reach out to people? How often do you start conversations? Are there times where you, don't get the joke? And how often does that kind of thing happen? And so really it's kind of talking through things at the client's level that gives me information about their, their social and their emotional profile.
Yeah. Just to kind of, wrap things up here, right? As we finish up, what is like one message that you could share to somebody who's experiencing ADHD or symptoms, autism, and not going to your business or anything like, or going to your practice or anything like that to get diagnosed? What's one message that you could share to them to kind of can encourage and keep in mind, trying to break the stigma?
Yeah. I guess the one thing I would say would be that you are worth it. So you get to decide, this is important. It's important for you to understand yourself. And, even if someone else doesn't think that it, is a good use of your time or your money or your resources, if it's important to you, then it's important.
Yeah, I think that's good. You know, um, I just wanted to say lastly, like it kind of like it was so interesting when you said like a while ago people would cry after the diagnosis, like it was the end of the world. And I think back to mine, and my parents give credit where credit is due. They were very good about that. I don't think they cried. I don't 100% remember, but there were definitely people like, oh no no, you're fine. You don't have that like that, and like no no no, only like this type of people have that. And I was like, yeah, it never like bothered me that much because in a way it always felt like something I could capitalize on that was an advantage, that was an asset. Like you said, like I think in a certain way, I think in a different way. Maybe it takes me a little like I'm not necessarily longer, but I like to go think deeper about things. I like to, make connections, whether it's in math or science or whatever. And it's helped me a lot. And being able, just as a message to a parent, maybe a kid who's watching, I was able to embrace that, and I feel that the success I've had now is in large part due to my ADHD and being able to think differently. So I think it's fueled my success in a way. And if I could go back and say, "Oh, you could have it, you didn't have it," or anything like that, I wouldn't do it, not even close. So it's really what you make of it, and it can be a huge asset, and it definitely was for me.
Yeah, absolutely. I mean, there's evidence that many of the most successful people that we think about, have had, dyslexia or left-handed, so I think that there's absolutely something to that when you have to, when you feel like the world is not designed for you and you get used to finding workarounds. And, I think that the world is your oyster.
For sure. Well, Jessica, it was a pleasure having you on the podcast. Just one more time, you said your practice was the Help and Healing Center.
Yes.
So if anyone's like interested, can they just like search that up? You guys have a website and like they can get connected that way?
Yeah. Yeah. So yeah, our website is helpandhealingcenter.com. And you can also find me on TikTok, as long as TikTok is around, at Dr. Jessica Myszak.
Perfect. All right. Well, that's it for today. My name's Ethan.
I'm Ben.
I'm Kabir.
Just remember, your mind matters.